Good morning, everyone. Thank you all to all of our media partners for joining us here today. My name is Xochitl Mora. I am the Director of Communications for the City of McAllen, and we thank you for joining us for this very important press conference as we continue to move forward and through this pandemic as a partnership between the City of McAllen I.S.D, and Hidalgo County. Today's vaccination clinic was something very important for all of these partners to be able to offer to the residents in the community of McAllen, and we'll be hearing from all of them. Before I continue, I would like to recognize all of our honored guests today whom you'll be hearing from, including the Honorable Jim Darling, Mayor of the City of McAllen. The Honorable Veronica Whitaker, Mayor Pro Tem, District 6 Commissioner for the City of McAllen. The Honorable Omar Quintanilla, Commissioner District 3 for the City of McAllen. The Honorable Eli Torres, Commissioner Precinct 4 for Hidalgo County. From McAllen I.S.D, our Superintendent, Dr. J.A. Gonzalez. And from Hidalgo County Health and Human Services Chief Administrative Officer, Mr. Eddie Olivares. I would also like to recognize one of my bosses, Mr. Jeff Johnston, who is the Emergency Management Coordinator for the City of McAllen, who has been handling the City of McAllen's efforts through this pandemic for both the residents and our employees. Mr. Johnston, thank you for your leadership and guidance on this. Thank you. To welcome all of you here and for some brief remarks, I'd like to bring up the Honorable Jim Darling, Mayor of the City of McAllen.
Thank you, Sochi, and welcome everybody. I presume everybody's here to line up to get their vaccinations, but you know, it's this pandemic has brought new things. We haven't had anything like this. I remember as a kid, they had the polio vaccine, was similar like this, but you know, vaccinating 900,000 people in the county is not an easy process. And so the best thing I could say to people is, let's be patient. You know, we're going to get to everybody. Let's be patient out there. Let's be courteous. Let's not forget that we're all in this together. And let's continue to wear our mask and be safe out there. And so hopefully this vaccination process will be orderly, and I think we have some great partnerships we're going to talk about. So thank you for being here. And the most important thing is to make sure people are patient and continue to be safe. Thank you very much.
For some remarks from the City of McAllen, I would like to bring up the Honorable Veronica Whitaker, Mayor Pro Tem, District 6 Commissioner.
Good morning, everyone. Happy to be here with all of you this morning. Good morning. First and foremost, I'd like to thank Hidalgo County for their partnership and guidance since the beginning of this pandemic. This pandemic is a joint effort between the City of McAllen, McAllen I.S.D, and Hidalgo County. I would also like to thank the incredible nurses from the McAllen I.S.D for being here to provide the vaccines to 800 of our most vulnerable residents. We are grateful to the healthcare professionals throughout the Rio Grande Valley, Texas, and the United States who have been in the front line of this pandemic. We couldn't be here today without all of their efforts during this time. This is the first COVID-19 vaccination clinic hosted by the City of McAllen. And we are hoping to continue to do this for our residents. It's so much important. As per state of Texas protocols, today's clinic is meant to reach the most vulnerable population. And those population is basically the healthcare workers, those who are over 65, and those who have underlying conditions. However, we hope as more doses come to Texas and make their way down to the Rio Grande Valley, that we, along with the Hidalgo County, will be able to expand to reach out to those who get the vaccines until we are all vaccinated. This is the only first of the doses in the City of McAllen, and we're very, very grateful. Remember, you all will have to come back, though, for your second dose. It doesn't protect you until your second dose, and after your second dose, not even until maybe a month later, and you're only protected by 90 to 95%. So don't let your guard down. Understand that even though you've got your doses, even though you've got your vaccine, you must still remain with your mask on, social distance, stay home as much as possible, and be careful for the sake of our entire community. So we ask again, please follow the guidelines, stay safe, and many blessings to all of you. Thank you.
Thank you, Commissioner Whitaker, for serving as a leader in our community and by leading by example with our safety protocols through this pandemic. For additional remarks on behalf of the City of McAllen, I'd like to bring up the Honorable Omar Quintanilla, Commissioner, District 3.
Good morning, everyone. It's a great day in the City of McAllen where we get to have our first vaccination clinic here in the city. I'm excited about it. I know the people that are getting their vaccine are excited, and you know, we are hoping that this is just the first of many to come in the City of McAllen, because we have much more work to be done. There are many people that are in need of the vaccine. Most, if not all, hopefully will get the vaccine, and we're hoping that today is the first day of many more clinics that will take place here in McAllen. I'd like to first thank Commissioner Torres for her efforts in helping to make this possible here in McAllen, and of course Judge Richard Cortez and also Mr. Olivares, Health Director for the county, for their leadership in this whole in the effort to help our county really prepare for the pandemic. And I'm grateful for their leadership. I'm also grateful for the leadership of McAllen I.S.D. through Dr. Gonzalez and the nurses that are here today to help with the vaccination efforts. So these nurses would typically be at school today, but they're here helping to with the vaccination efforts here with us today. So I want to thank them for helping us today. I do also want to emphasize that the City of McAllen put together a online registration effort and a drive-by registration effort yesterday. And even though many weren't able to access because of the limited amount of resources, we want to emphasize that please be patient because we know that there will be other efforts in the future, more clinics to come, and so we're asking for your patience in that. Please also be looking through the media for additional vaccination clinics to come. But I do want to emphasize that the county has done a great job in their efforts, and I want to thank them for what they've done so far. Thank you very much.
Thank you, Commissioner Quintanilla. To talk about McAllen I.S.D's efforts to assist with today's vaccination clinic, I'd like to bring up the Superintendent of MISD, Dr. J. Gonzalez.
Good morning, everyone. Thank you for being here at this special event. This is a very proud moment for us as an ISD. When you look at McAllen ISD and the partnership that we have with Hidalgo County and the City of McAllen, it's one of extreme synergy. And it's one of extreme teamwork. And I've been with this district for 23 years, and this is one of the proudest moments, because to come together as a team is one thing, but to come together as a team in the middle of a world pandemic to provide our community with vaccinations proves not only that we have a solid relationship, but also proves that we have the capacity to take care of business in a very big way. As a district, we have 52 people that are working in conjunction with the City of McAllen and the county. We have 18 registered nurses that are providing vaccinations. We have 3 registered vocational nurses that are doing the same thing. And then we have our principals and executive directors and directors that are side by side with our nurses doing the intake process as well, along with the McAllen I.S.D. PD working in conjunction with the City of McAllen PD. So when you look at all those moving parts and you look at the systems and processes that we've developed together, it's world class. And I want to thank the County of Hidalgo from the bottom of my heart, and the City of McAllen and all the great people that work for those entities, and also thank everybody on our team in McAllen I.S.D. It's a proud moment for us. Thank you all very much.
Thank you, Dr. Gonzalez. Thank you for your leadership and for what you do for our students and all of the employees of MISD on a daily basis. To talk about Hidalgo County and the efforts that they have undertaken since the start of this pandemic, I'd like to bring up the Honorable Eli Torres, Commissioner, Precinct 4.
Good morning, everyone. I know that there's been a lot of thank yous that have been shared here, but I'd like to reiterate our sincere thank you and gratitude to the City of McAllen and the McAllen Independent School District for their partnership, as well as all the other cities and school districts who have partnered to see these vaccines get into our people's arms. And so with that being said, I want to remind everyone that we are at the mercy of the state for the vaccines. There are more to come as they're being produced, as we've been hearing on the national news. Production is what's limited. It's not our resources to get them into people's arms. The production is what's limiting how many we can get out there. But please know that as they come to the county, we are turning it around with partnerships that exist with our school districts and our cities to get them to our constituents ASAP. So that being said, I'd like to remind everyone that these clinics are for, at this time, persons ages 65 and older, persons that are 18 and older with health conditions, and our first responders. It's easy to look at someone and see a young person getting a vaccine and jump to the conclusion that there might be some sort of a cheat there, but quite honestly, people don't walk around with their health record above their heads. So let's be respectful and mindful that there are health conditions that are not vivid to the eye. And so let's just all respect that we are doing our best to make sure that everyone who is receiving the vaccine is qualified under the conditions that I just shared. Additionally, I'd like to ask for everyone to please continue to follow the CDC guidelines of wearing your facial covering, even if you have received the vaccine. Also, the social distancing and stay home as much as possible. Like Ms. Whitaker shared earlier, this is not 100% protection. So that being said, please know that we are here to continue our partnerships, and as our doses are increased to us and other entities that receive these doses, because there are other entities that receive the doses of vaccines. We have local DHR, for example, our UTRGV, doctor's offices, pharmacies, as well as the county. So there's a variety of entities that are receiving the vaccine and creating these clinics as fast as we can. So again, we ask for your patience. We do also want to remind everyone who did already receive their first vaccine that they must report to the same place and same location for their second dose. It is very important that their first dose and their second dose match in the brand of the vaccine. If you receive a Moderna vaccine, your second dose needs to be a Moderna vaccine. Same thing with Pfizer and so forth. So again, we want to thank everyone for their partnership, for their patience, and just a reminder, there's almost 1 million people here in the Rio Grande Valley, or actually in Hidalgo County, almost 1 million people, times 2 doses per person, that's 2 million doses. So again, thank you so much. We're committed to our partnerships, and again, thank you everyone for being here this morning.
Thank you, Commissioner Torres, and to all the commissioners of Hidalgo County and Judge Cortez for your leadership during this pandemic. To talk a little bit more about the Hidalgo County's efforts, specifically on the administrative process, I'd like to bring up the Chief Administrative Officer for Health and Human Services, Mr. Eddie Olivares.
Good morning, everyone. It is a pleasure to be here in this beautiful facility. I mean, this is gorgeous. City of McAllen is first rate, the leader in our community. We have had the honor, Hidalgo County Health and Hidalgo County Emergency Management has had the honor of working with the City of McAllen in many events. We've responded to Hurricane Harvey, Hurricanes Harvey and Hurricane Ike. We've responded to high water events, large grass fire events, public health events, H1N1, measles, mumps outbreak. City of McAllen, McAllen School District, by far are the leaders in our community that we count on to work together hand in hand in the county of Hidalgo. And again, I'd like to thank the mayor, the city council, Dr. Gonzalez. Your nurses are the finest, your educators are the finest. I cannot extend my thanks to them. I want to start off by saying 2 things. One, we got the beginning of the end. I see the light at the end of the tunnel, and it's not a train, okay? I really do. But it's going to take time, and it's going to take a lot of effort from the community. Our pandemic, this virus, is still killing people every day. We had 21 people die yesterday, all right? We had 21. 17 the day before, 18 the day before. We have over 400 in the hospital today, over 180 in ICU. This is not over with. But the thing is, everyone needs to continue to follow the different precautions, the different methods to prevent this. Vaccination is getting delivered to us as fast as possible. We do not have control of the vaccination. It starts at the federal level, the pharmaceutical level, then it comes down to the state level, and we are at the beck and call of the state to determine how much vaccine we get. Hidalgo County is a high-risk county. Hidalgo, Cameron, Webb, and El Paso County along the border are considered high-risk counties and are a priority for vaccine. We have 1.2 million people in this county, according to the Department of State Health Services. We're doing the best efforts we can. But let me tell you, the best part, the thing that's heroic, the item that's important, and you all, if you do not put it in your story today, I will be so disappointed. The reality is this is a regional operation. We have school nurses, clerks, we have city public works people, fire departments, police departments, private EMS systems. It is a regional event that we all work together as a team under incident command structure. Emergency managers from the school districts, from the cities, work with Chief Saldana, emergency manager of the county, work with us to coordinate these efforts. It is a coordinated effort with Doctors Hospital Renaissance. It's a coordinated effort with UTRGV. It's a coordinated effort with all those pharmacies. Remember, we're not the only ones getting vaccine. This coming week, there's over 17,000 doses of vaccine coming to Hidalgo County. All right, it's being distributed to various entities, the county, the hospitals, pharmacists, doctors. So we're doing the best we can with what we have, and the vaccine is there's this notion that vaccine is being stored in refrigerators and put there. Let me tell you, by this afternoon, by 1:30, 2 o'clock this afternoon, we won't have a drop left. It's gone. And we're already anticipating our allocation for next week to get delivered today, for next week. And by this time next week, it's gone. So it's not being stored like a lot of people think it is. It's being used. We're very thankful to all our partners. The other part that's important to understand, and there's a lot of confusion. If you'd had like for example, we're going to have we had our first event in Mercedes and La Jolla 3 weeks ago. In a couple of weeks, we will be having, like on February 3rd, we'll be having our second dose event in Mercedes. And the next day will be the second dose event in La Jolla. If you took your first dose at a county clinic, you go back to that county clinic in 28 days. We're using Moderna, and get your second dose there. It is very important that where you got your first dose, you get your second dose. And then it's also important that you get the same brand. Now, we may have some winter tourists. We may have some people who travel that may have gotten vaccinated up north or in other parts of the country that are here visiting, and it's time for their second dose. Make sure it's the same brand. Very important. But we're here to assist with that. Today, we're going to do over 1,000 vaccines today. We're prioritizing our senior citizens, our school nurses. Our school nurses are critical, and Dr. Gonzalez has committed, along with the other superintendent, Dr. Canales yesterday in Westlaco, Dr. Saenz in La Jolla, all the superintendents have committed to use their school nurses. Why is that? The day is going to come when our allocation is there, and we need to vaccinate all the school teachers. Well, guess what? We're going to rely on the school nurses to help vaccinate the school teachers. We're going to rely on the school nurses to help vaccinate other partners in the community. Maybe they're special ed students, or maybe their families, or maybe look at home health care and other entities. Those school nurses are a critical, essential partner in our community. That is very important. Hidalgo County, thanks to the direction of Commissioner's Court and Commissioner Torres, has identified permanent pod sites for Precinct 4, Precinct 1, Precinct 2, Precinct 3 have all identified permanent pod sites. We're going to have as many as 6 to 7 permanent sites across the county that once allocation increases and ramps up, that those sites will be providing vaccine consistently based on allocation. That's the plan, and we're using school nurses, paramedics, firefighters to immunize. Very clear, structured plan. All we lack is vaccine. But once it starts ramping up, we're ready for it. And we ask everyone to be patient with us. We're doing the best we can. But I tell you what, you go to this event here, you go to the La Jolla event, you go to the Westico event, you go to them, it's like a fine oil machine. You've all seen it. It's very, very consistent. It works very well. I'll pause here for questions or comments from anyone regarding COVID. Yes, ma'am. Okay, I'll do it in Spanish. So aquí estamos hoy mismo, aquí en este edificio tan hermoso, aquí en la ciudad de McAllen, que en nuestra parte de la ciudad de McAllen nos ha asistido varias veces en huracanes, incendios, diferentes tiempos de emergencia. La ciudad de McAllen ha sido nuestros amigos y los ha ayudado bastante en participando, en salvando vidas, en asistiendo a las diferentes comunidades en el estado de Texas. Hoy mismo tenemos una clínica aquí en el centro de convención. Estamos trabajando mano a mano con el distrito escolar del doctor González, del superintendente y la mesa directiva de la escuela aquí en McAllen, a eso de esfuerzo para asistirlos hoy mismo. Las diferentes agencias, departamentos de la ciudad de McAllen, el chief Rodríguez con la policía, el chief de la policía del distrito escolar, departamento de bomberos, todos están trabajando mano a mano hoy para vacunar gente aquí mismo en el centro de convención aquí en McAllen. Más de 1,000 dosis se van a dar hoy mismo para asistir a la gente aquí en esta área y estamos haciendo todo el esfuerzo posible para asistir. Los dosis que nos caen a nosotros es el estado, son los que figuran qué tantas dosis vienen de diferentes partes del estado. El condado de Hidalgo, el condado de Cameron, el condado de Webb, el condado de El Paso son áreas de alto riesgo y el estado los tiene de prioridad para recibir vacuna. Pero los dosis que vienen depende en lo que decide el estado y lo que decide al nivel federal. So aquí mismo hoy estamos listos. Otra cosa, si ya tomó la primera dosis de Moderna, de vacuna, regrese al mismo lugar donde tomó esa primera dosis. Si fue, como por ejemplo en Mercedes, con nosotros la primera semana de febrero, vamos a tener otra clínica en Mercedes que va a ser para la segunda dosis. La gente que fue allí, vayan para atrás allí para la vacuna. Si fueron a La Jolla, la primera vacuna, van a regresar allí. En 28 días van a regresar aquí. La ciudad de McAllen está preparada, el distrito escolar está preparado, que en 28 días regresan aquí. Es muy importante que si fueron a la clínica del condado por la primera dosis, ahí van para la primera dosis. Si fueron a DHR, si fueron a UTRGV, regresen ahí para la primera dosis en esas áreas, porque tiene que ser la misma tipo de vaccine. Si tomó Moderna primera vez, la Moderna tiene que ser la segunda vez. Si tomó Pfizer la primera vez, Pfizer tiene que ser la segunda vez el mismo tipo y la misma marca de vacuna. Gracias. Other questions? Yes, ma'am.
Hi, Alyssa Cole with ARTC. I have 2 questions for you. The
Sure.
first one is, you said more than 1,000 doses will be administered today. Do you have that exact number?
I have a number that's going to say 1,000 doses. That's the exact number. 1,000 doses today.
Of Moderna, correct?
Of Moderna. Yeah, the county does not handle Pfizer.
Okay, perfect. And my next question for you, a lot of people contacting our station wondering, are school administrators and their families getting early access or priority to vaccines where you all have partnerships with school districts?
So what we're doing here and getting our school nurses ready and our school leadership ready, school districts have put forth their teams to assist us with vaccination. So I guess in return, that's an easy word to say, they're getting vaccinated. So all the school nurses are getting vaccinated. We're looking at school nurses, people who do testing in schools, because a lot of our schools are doing the COVID testing, and a lot of them are not this, believe it or not, are the principals, like in the elementary schools. It might not be a nurse, it may be a principal doing the testing of their staff and the children every day. All right? So any of those people who are exposed to that type of scenario, they're looking at getting vaccinated. We're giving a limited amount of vaccine to those entities that are in turn helping us vaccinate others. So as part of the system, along with first responders, along with EMS medical personnel, along with those that are helping us. So yes, there is people from the school district who have been identified as assisting with vaccination components, not only here, but in the future, and they're being vaccinated.
And people need to understand, like you said, they're not just nurses, they're also teachers, administrators, principals.
They're people, and I have already answered your question, ma'am, okay? There are people who the school has identified as part of the vaccination team. I was going to say testing team.
Could you say that again in Spanish?
Sure. Para nosotros la pregunta era, se está informando a la gente que hay maestras, trabajadores del distrito escolar que han recibido vacuna. Nosotros estamos trabajando mano a mano con los distritos escolares, con las ciudades, con diferentes agencias para asegurar que tenemos un equipo listo para vacunar. Esos equipos, esos miembros de esos equipos, nosotros los vacunamos a ellos para que ellos estén protegidos y preparados para asistir en las clínicas de vacuna que van a seguir por muchos meses. ¿Ok? Sí se han hecho esas vacunas, pero son para la gente que van a dar asistencia directamente para las vacunas en el futuro. El doctor González, la doctora Sáenz, la doctora Canales, los diferentes superintendentes, ellos ya pusieron el equipo de ellos y ese equipo va a estar para el tiempo que va a correr para las vacunas de aquí hasta que pare este programa y nosotros estamos asistiendo para vacunar a esas personas que van a trabajar en las vacunas. Other question.
¿Me podría clarificar otra vez los 301, 34 van a tener, qué eran los que hicimos para hacer más vacunaciones?
I'm sorry, you're going too fast.
Que mencionó los 301.
2, 3, 4.
¿Me pudiera explicar pero en español de manera más despacio? Que estos van a ser sitios
Despacio.
donde se puede ir y hacerse la vacuna, ponerse la vacuna.
Sí.
Son sitios móviles, ¿qué es eso?
Cada precinto, los comisionados de cada precinto con el juez Cortés tienen un plan de largo plazo. Van a trabajar para los meses que vienen. Cada precinto está identificando las áreas principales, escuela, ciudad, etcétera, que quieren usar como se dice, clínicas permanentes que van a estar asistiendo a las semanas y los meses que vienen. También van a haber oportunidad para otros lugares que pueden ser on rotation, que van a estar en rotation. Pero esas decisiones se van a hacer al nivel de los comisionados y la corte del comisionado, los comisionados aquí en el condado de Hidalgo. Pero todo esto depende en qué tanto vacuna recibimos. Podemos tener 10 lugares. Pero si nomás los cae suficiente para correr 2, es todo lo que los cae. Pero nosotros estamos haciendo el plan que va a haber un día que vamos a tener 20,000, 30,000 vacunas, 40,000 vacunas. Estamos preparando ahorita para esos días que cada de esos lugares, esos 6, 7, 8 lugares, dependiendo, todos van a recibir bastante vacuna y todos van a trabajar independiente, con la asistencia de las escuelas, con la asistencia de las ciudades, con las diferentes agencias locales, para asegurar que esas vacunas se den a este tiempo que las recibimos en esos números.
Mr. Olivares, you mentioned that
Thank you for English.
you mentioned we could possibly be receiving up to 17,000 vaccines for next week, as early as today.
It depends on FedEx and UPS.
And those 17,000, are those being delivered just for the county or?
No. I need to explain again. I don't know if you heard me. The state allocates vaccine for individual providers. For you to be a provider, you register with the state. The state has a criteria. The state then aligns you as a provider. The pharmaceutical company sends the vaccine straight to the provider based on what the state orders to do. Okay? So I do not receive all of them and distribute them. No. I only get the allocation given to Hidalgo County. DHR gets their allocation. UTRGV gets their allocation. Dr. X gets their allocation. Pharmacy X gets their allocation. It goes straight to them.
And so that 17 is a combined.
Based on information the state's giving us now. Do they actually receive it in those numbers? It depends on the state and the pharmaceutical companies how they distribute it. Other questions? Thank you very much, Sokshi.
Thank you, Mr. Olivares, and thank you to McAllen I.S.D. and of course to the leadership of the City of McAllen for this effort today. I want to thank all of you for being here at this press conference so that we can continue to inform our community throughout this pandemic as we continue with vaccination clinics. I do want to remind you that the City of McAllen will serve as a press pool footage for today's vaccination clinic. So we will, my camera crew will be heading out there, and we will provide video footage for all of you to use later on today for your newscasts and programs regarding today's vaccination clinic. So thank you all for joining us today. Please continue to stay tuned to the City of McAllen on our website, social media, and of course on MCN 1300. And again, thank you to all of our partners and our leaders for guiding us through this today.